Hello friends, myself Professor Sanjay Purohit. I would like to extend a warm welcome to you on my YouTube channel. I would like to thank everyone who has subscribed my channel and encourage you to do so that you will get a new video notification earliest. Friends, today we are going to talk about principles of fracture management. In the orthopedic series, this is my second lecture. Friends, as we know, fracture is referred as breach in continuity of hard tissue, especially the bone and cartilage. The main cause of the fracture are trauma that may be due to by falling from the height or automobile accidents. These type of the cases are reached to us with severe bleeding, respiratory distress, and in shock. So to treat this type of the cases, we should follow the 4R principles of fracture management. In this lecture, we will discuss about the 4R fracture management principle. What are the 4R? It stands for resuscitation, reduce, retain, and rehabilitation. Resuscitation is performed by ABCDE approaches. Then after the resuscitation, reduce the fracture segments. The reduction of the fracture segments is performed by open method, closed method, or hybrid method. After the reduction, retain the fracture segments. We can retain the fracture segments using the external immobilization technique, internal immobilization technique, or hybrid immobilization technique. After the fracture healings, the patients are rehabilitated. Rehabilitate help in reducing the edema, restore the joint movement, restore the muscle power, and help in back to normal activity of the patients. First, we discuss about resuscitation. This is performed by ABCDE approaches. A stands for the airway. So, ensure the patency of the airway. Then B for breathing. Check the respiratory rate. C for circulation. Evaluate the capillary refill time and pulse rate of the patient. Then D for disability. Check the level of the consciousness of the patients. Then E for exposure. The whole body of the patient should be observed and palpate to evaluate the trauma, bleeding, or any skin marks. The resuscitation process is life-saving process, and this should be performed as per the need to save the life of the patient. The aim of ABCDE approaches are to provide life-saving treatment, to break down the complex clinical situation into more manageable part, to serve as an assessment and treatment algorithm, to buy the time to establish a final diagnosis and treatment. Friends, after the resuscitation process, we should follow the reduce, means restoration. Re means back, reduce means bring. So the reduce is referred as bringing back the normal alignment and apposition of the fractured segment of the bone. Reduce describe how a bone is fixed or set after the fracture. Bone fragments must be put in close proximity to one another so that healing can occur. Reduction of the fracture segments should be performed as soon as patient's condition permit. Means after the resuscitation process, we should perform the reduction earliest. Attention should be given to eliminate the rotation and angular deformity of the distal segment. Two radiographic view, including the proximal and distal joint, are essential to ensure the anatomical alignment of the bone. The reduction of the fracture segments can be performed by three ways. First is closed reduction, open reduction, and hybrid reduction. Reduction of the fracture segments by traction and counter traction. In this, the two forces are applied on the bone in opposite directions to create a gap between the fracture segment. Then push the distal segment in this direction for the anatomical alignment. Then the bone force is toward the fracture site to minimize the gap between the fracture segment. In this picture, the traction and counter tractions are applied. One rope is put around the axillary or the growing region as per the fracture location. That may be in the forelimbs, that may be in the hind limbs, and another rope is put around the paw or fetlock joint of the animals and pull in opposite directions. And traction and counter traction are applied to reduce the bone segment. Reduction of the fracture segment by angulation and toggling method. Initially, the fracture angulation is increased. By this, force is applied in this direction to increase the angulation. Then edge-to-edge cortical contact. Edge-to-edge cortical contact is achieved like this. Then rotational and orientation of the limbs align is restored by forcing the distal segment in this position. And finally, after the alignment, bone is in this shape like this. Bone comes in this shape. After the reduction. Now we discuss about the close reduction of the fracture segments. Correct positions without surgical exposing is essential for the early healing of the fracture segment, bone fractures, preserving the soft tissues and blood supply, which help in speedy healing of the fracture, thus decreasing the risk of the infection, reducing the operating time. Occasionally, specialized instruments are used, suitable only if the bone fragments can be palpated. Sedate the patient to permit the time for swelling to subside. Traction and counter traction, extension and counter extension are used to reduce the fracture segments. Most suitable for the bone below the elbow and staple joint. These are easily palpated. Perform gently to avoid the dew fracture that occurs with reduction. Difficulty of the gaining the accurate reconstruction. In that conditions, we should shift on the open reduction of the fracture segment. Don't wait for swelling to go down. It will not regress until the reduction restored the normal circulation. Initially, the contracture and overriding are primarily muscular in nature and respond well to traction, anesthesia, and muscle relaxants. After the period of 2 to 3 days, the inflammatory reaction and its proliferative changes cause much more permanent and difficult to overcome the contracture. Method of close reduction. First is manual traction. Rope loop is placed around the axillary or growing region and anchored to the edge of the table near the animal's back. Another rope loop is placed above the fetlock joint and traction are applied against the first rope. In this, one force is in this direction, another force is in this direction, and create the gap. After that, after creating this gap, we try to anatomical alignment of the fracture bone. Gordon extender, the mechanical device that allow comparable traction. The relaxation of the muscles is best accomplished by a slow, progressive increase of the traction over the 10 to 30 minutes. In this, the Gordon extender is fixed in the axillary region and like this, and the paw of this or toe region is fixed to by the rope and a traction force is slowly applied in this direction and the anatomical reduction is achieved. Gravity. Gravity is used to obtain the traction. Position of the animal on its back and place soft rope around the paw of the affected limb. Then attach this to an infusion stand or to a ceiling mounted eye bolt. The length of attaching materials is adjusted to raise the animal slightly off the table. Traction time 10 to 30 minutes. In this, the one rope is placed around the fetlock of paw and anchored to ceiling eye bolt and lift slightly from the tables, and due to the gravity, the traction due to gravity and weight of the animals, these forces are generated. This helps in reduction of this fracture segment. Procedure. This is painful position, so use analgesic, local anesthetic or the nerve block. We can use sedative or general anesthetics as per the conditions or temperament of the animal. Reduce the bone in right position and confirm radiographically. Cast or splint put to keep the bone in the right position and protect it while it heals. Now we discuss about the second method of reduction, that is the open reduction. This is suitable for unstable and complicated fracture. It is indicated in several days old cases. This is also indicated in the fractures of the articular surface of the bone. The open reduction indicated in the internal, where the internal fixations are used to immobilize the fracture segments. Obtain adequate surgical exposure of the fractured bone, handle the soft tissue gently, and preserve soft tissue attachment to the bone fragments. Prevent trauma to major nerves and blood vessels. Be gentle and efficient. Attain strict hemostasis. Method of open reductions. First one is application of levering devices by use of the some instruments such as osteotome, periosteal elevator, or scalpel handle. In this, the levering device is put between these two bony segments. This is the first segment, this is the second segment. Put the levering device between the two and force in this direction and try to anatomically align the bone. After the anatomical alignment, the levering device is taken out. Now we discuss about the second application of the direct force using the bone holding forces on the one or more bone fragments and try to put in the anatomical alignment to push in this direction. Third one is direct application of distraction forces on the both bone fragments. We can use traction and counter traction and corrective the rotation bone forces. Corrective rotation by the bone forces. In this, these two bone holding forces are applied in the first segment and second is on the second segment, and then put the distraction forces in the opposite directions and create the gap between the fracture site, and then the bone are put into the anatomical alignments. Using the internal immobilization techniques, we can use to bone holding forceps and to hold these reduced segments in the position. Direct application of the force on both the bone fragments combined with use of the levering devices or instruments. In this, the two bone holding forceps are used in the one in each segments. Hold these using the bone holding forceps. Then put the distraction forces in the opposite direction like this and this, and use a levering devices between the fracture end of the bone, and using the combination of these, the anatomical alignment is achieved. Fifth is use of fracture distractor. This is helpful in multi-fragmentary fractures, and direct distraction forces are applied. Fixation pins are applied through the both cortex, then attached to the distractor with the finger nuts. One fixation pin is placed in the proximal segment and second pin is placed in the distal segment, and these pins are fixed on the attached to the distractor. Then wing nuts on the threaded rod allow the fracture to be slowly distract until the fragments can be secured. This one, then these fracture segments are anatomically secured. We can use the bone holding forceps to hold the fracture segments in the position. 6.1. Use of Steinmann pin as fracture distractor. The Steinmann pin is done by the normograde or retrograde approach across the fracture line. This facilitates the distal fragments angulated to restore the axial alignment and porosity distractions. And after the axial alignment and distractions, the bone segments are placed in the anatomical alignment. Procedure. This is most indicated in the most severe fractures. The open reductions are followed by the internal fixations. So, in orthopedics, this is known as ORIF, open reduction internal fixation technique. Fracture site is adequately exposed. Bone pieces are brought together, fixed together with metal implant. After the clinical and radiographic healing, implant are removed. Now we discuss about mixed or hybrid reduction method. In this, percutaneous pins are used and pass through the skin into the bone pieces to reduce and hold them in place, as in skeletal traction. The pins are left in the place until adequate healing takes place. Occasionally, a metal frame called external fixator is used to hold the pin and bone in place. After reduction, we follow the 10 principle of fracture management. The 10 means to hold the fractured segment in position. There are 3 techniques to retain the fracture segments position. First one is external immobilization technique, then internal immobilization technique, and mixed or hybrid immobilization technique. The mixed or hybrid immobilization technique is the combination of external and internal immobilization techniques. So first is external immobilization technique. The external immobilization technique include, first is cast. 2 types of the cast are used in veterinary practice. First one is the Plaster of Paris cast and Fiberglass cast. Splints in the veterinary practice, splints are very commonly used, that are made up of the wood, that are the bamboo splints or wooden scale. Second one is the polyvinyl chloride PVC pipe or gutter pipe splint, metal bar splints. The other external immobilization technique is Thomas splint. The next one is the modified coaptation splint, Gordon extender, Metasplint, Yucca-board splint, Orthoplast splint, compression bar splint, Interdental widening technique. These are some external immobilization technique used in veterinary practice. Now we discuss about internal immobilization technique. The internal immobilization technique are used or placed inside the bone, in the bone marrow, or on the surface of the bone. So this is of two types: intramedullary and extramedullary. Intramedullary and extramedullary internal immobilization technique. First is intramedullary immobilization technique. In this, we are using Steinmann pin, Kuntschner nail, canal, rush pin, cross pinning, threaded intramedullary pin, interlocking intramedullary pin, intramedullary interlocking nails. Now we discuss about the extramedullary internal immobilization technique. This include the bone plate, winding, and screw. Bone plates are mainly two types: DCP, dynamic compression bone plate, and NP, neutralization bone plate. Wiring are two types: circlage wiring and hemi-circlage wiring. When the wiring is cover the whole surface of the bone, that is the circlage wiring. If the half surface or his bone is inside the wiring, that is known as hemi-circlage wiring. The screws are broadly two types: cortical screws and cancellous screws. These are used as extramedullary internal fixation technique. Now we discuss about the mixed or hybrid immobilization technique. This type of the technique, the major portion is outside the skin and pins are pierced percutaneously into the bone in the proximal segments or distal segments as per the requirement or as per the technique. In this, first one is the hanging pin cast, working cast, transfixation, pinning and casting (TPC), external skeletal fixator. This include circular external skeletal fixator or linear external fixator. The circular external skeletal fixator is known as Ilizarov fixator. The linear external fixators is further two types: bilateral or unilateral. Bilateral are placed on the two sides, while the unilateral are placed on only one side, like this. Unilateral are placed on only one side. Acrylic and epoxy-pin fixation system and hybrid external fixators. These are the combination of the circular and linear external fixator. Selection of fixation method. The component to consider when approaching to selection of the potential fixation methods may be external coaptation splint, cast or the splints, intermedullary pin or K-wires, external skeletal fixator, interlocking nails, and bone plate or the screws. These are the least invasive, but these are the most unstable too. most invasive but most stable type of the immobilization technique. So we select as per the type of the fractures, type of the forces, and as per the other requirement of the patient. For the selection of the suitable immobilization technique, these are some factors: patient, client, fracture, and veterinarian factors associated or helpful in selection of the suitable immobilization technique. So first we discuss about the patient factor. Patient factors are the size of the animal, age of the animal, body weight of the animal, breed of the animal, body condition of the animal, as well as the activity level of the animal should be considered while selecting a immobilization technique. The client factors that include the finance, compliances, and husbandry practices adopted by the animal owner. Fracture factor: configuration, location, bone forces, or contamination should be considered while selection of the suitable immobilization techniques. Veterinarian factors: understanding of the biomechanics and healing, experience and skill level knowledge of the particular implant, and implant availability should be considered while the final selection or using the internal or external immobilization technique to treat the fracture. Choosing between external and internal fixation, the main base is counteracting the forces. If the suitable technique is counteract the force or not, the external coaptation can effectively counteract the bending and rotational forces, provided the joint above and below the fracture are immobilized. Fracture have the compression, shearing, tensile forces are required the internal fixation technique. The comminuted and long oblique fractures are not ideal for external coaptation splints, so these type of the fractures should be managed by internal fixation technique. Fracture treatment planning checklist: decide on appropriate fixation based on the fracture and patient assessment. Plan fracture reduction, plan fracture fixation, select the surgical approaches, check the implant inventory, perform surgery, critically evaluate the post-operative radiograph. After the fracture healing, the patient should be rehabilitated. So rehabilitation is the process that helpful to reduce the edema, to restore the movement of the joint, restore the activity of the patient. This is performed by manual therapy that include the massage, joint mobilization, joint compression, and stretching. We can use the therapeutic exercise to rehabilitate the patient. There are several modalities that are helpful in early rehabilitation of the patients that are laser, therapeutic ultrasound, TENS, magnetic field therapy, thermal therapy that include the hot therapy and cold therapy, shock wave therapy, acupuncture are also helpful. we can use the hydrotherapy to rehabilitate the patient. These are some rehabilitation techniques used in veterinary practices. Friends, based on today's lecture, we designed some questions for you. You are requested to solve it. On the end of this video, we provide the answer so that you will check the answer yourself. Question number 1. If a dog has suffered severe trauma resulting in a fracture, how do you intend to carry out the treatment? Option A. First, select the immobilization technique. B. First, manage the shock and save the life. First, radiograph the fracture part. First, select the reduction technique. Question number 2. Gordon extender is useful in option A. Open reduction. Option B. Close reduction. Option C. Internal immobilization. Option D. All above. Question number 3. Direct bone healing without the intermediate steps of fibrous tissue and cartilage formation is possible condition of good stability and a gap up to -mm wide. Option A 0.1 mm. Option B 0.3 mm. Option C 0.6 mm. Option D 0.9 mm. Question number 4. Following which is an external immobilization technique? Option A. Transfixation pinning and casting. Option B. Working cast. Option C. Fiberglass cast. Option D. Hanging pin cast. Question number 5. What is the optimum traction time when the muscles are sufficiently fatigued to reduce the fracture? Option A 10 to 30 minutes. Option B 30 to 60 minutes. Option C 1 to 2 hours. Option D 2 to 4 hours. Now answer time. These are the answer. Question number 1. Option B. Question number 2. Option B. Question number 3. Option B. Question number 4. Option C. Question number 5. Option A. Thank you for watching this video. You are requested to like, comments, share and subscribe my channel Futureverse. If you have any doubt, please write in comments box. I will reply. Thanks again.